Hey everyone, and welcome back to another explainer. Today, we're tackling a topic that is fascinating, incredibly common, and let's be totally honest here, sometimes just completely annoying. We're looking at the mechanics of nocturnal breathing and snoring. If you share a bed, a room, or, even just a house with another human being, you've almost certainly encountered the phenomenon of noisy sleep. But rather than just writing it off as a nuisance, today we're going to unpack exactly what is happening inside the human body when the lights go out. So, picture this. Have you ever been violently elbowed at 3 in the morning? Or, hey, maybe you're the one doing the elbowing, just desperately trying to get your partner to roll over and be quiet so you can finally catch some rest. It's really easy to joke about, but this noise isn't just an annoyance. It's actually a distinct mechanical issue happening right there within the airway, and it carries some very real health consequences. Your body is essentially functioning like an instrument, and when the acoustics change, well, it means the structure has changed. Here's our roadmap for today. Number 1, the mechanics of snoring. Number 2, the mouth breathing dilemma. Number 3, when to worry, specifically looking at sleep apnea. And number 4, steps to quieter sleep. Let's get right into it. Part 1, the mechanics of snoring. We're going to look at the actual physical reasons behind all that nighttime noise. Okay, so think of your airway like a physical pipe. When you're awake, your muscles do a great job of keeping this pipe wide open. But during sleep, if the airflow through your mouth and nose gets even partially blocked, that pipe narrows. As air squeezes through that newly narrowed space, it creates friction. And this friction causes the soft tissues, we're talking your throat, your tongue, the palate, to flutter and vibrate. That vibration is the literal definition of the snoring sound. It is, quite literally, the sound of air just struggling to get through. So what's causing this pipe to narrow in the first place? Well, we've got 5 common culprits. First up, nasal congestion. A cold or allergies force you to breathe through your mouth, which completely changes your airflow dynamics. Second is excess weight. Extra fat around the neck physically puts pressure on the outside of that airway, just squishing it down and making it way more prone to vibration. Third, your sleeping position. When you sleep flat on your back, gravity's literally pulling your tongue and soft tissues backward, which partially blocks the path. Fourth is alcohol consumption. A nightcap might make you feel sleepy, sure, but alcohol actively relaxes your throat muscles, allowing them to kind of collapse inward. And finally, aging. As we get older, our throat muscles just naturally lose their tone, increasing the chances of that soft tissue vibrating. Moving on to part 2, the mouth breathing dilemma. Basically, why your body just defaults to an open mouth. We've all been there, waking up with a mouth as dry as a desert, right? But why does the body automatically default to an open mouth during the night? Well, sleeping with an open mouth is essentially your body's backup generator kicking on. It usually means you just aren't getting enough airflow through your nose, so your brain throws a switch to bypass the primary route, just to get enough oxygen. The physical bottlenecks forcing this bypass are usually pretty clear. A standard nasal blockage is the most common, but you also have structural roadblocks like enlarged tonsils or adenoids, which can severely obstruct normal breathing. We see this a lot in kids, actually. Then there's a deviated septum, where the nasal passage is literally crooked, heavily restricting airflow. And lastly, for some folks, it just becomes habitual mouth breathing, a long-term habit developed over time, even when their nasal passages are perfectly clear. Now, we really need to understand the difference between an occasional stuffy nose and a chronic issue. Occasional mouth breathing, like when you have a harmless winter cold, is totally fine. Don't worry about it. But chronic mouth breathing, that introduces some seriously surprising hidden health risks. Doing this every single night leads to dry mouth, bad breath, poor sleep quality, morning headaches, and daytime fatigue, all because your oxygen intake is just less efficient. But get this, look at that second point on the right. Cavities and gum disease. No way, right? That is an incredibly unexpected risk of just sleeping with your mouth open, but it absolutely highlights how everything in the human body is connected when our baseline breathing mechanics get thrown off. Okay, part 3. When to worry, sleep apnea. This is where we transition from a simple nuisance to an actual health hazard. The big condition we really need to watch out for here is obstructive sleep apnea. This isn't just heavy breathing. It's a serious medical condition where loud snoring is combined with gasping, choking, or actual literal pauses in breathing during sleep. Remember that narrowed pipe we talked about earlier? Well, in sleep apnea, the pipe isn't just vibrating anymore, it is completely closing off. The brain literally has to panic, wake the body up slightly, and force a huge gasp just to restart the engine. It's a severe warning sign that you or your sleeping partner should absolutely never ignore. Aside from the obvious gasping at night, what are the daytime clues? Take a look at these symptoms. Excessive daytime sleepiness is a massive red flag.
You're exhausted because your brain is constantly waking you up to breathe, which completely destroys your sleep cycles. And that leads to morning headaches and difficulty concentrating. Over time, the constant stress on your heart from those dropping oxygen levels can even lead to high blood pressure. If you're seeing these interrupted breathing patterns and experiencing these symptoms as regular occurrences, it is definitely time to stop guessing and go seek a medical evaluation.
Which brings us to part 4, steps to quieter sleep. Essentially, your blueprint for better rest. So, our daily habits absolutely impact our nighttime mechanics. Just look at these highly achievable lifestyle adjustments. Sleep on your side instead of your back. This immediately counters that whole gravity issue we discussed earlier, keeping the tongue from falling backward. Maintain a healthy weight to reduce that external pressure on the airway. Actively treat your allergies and nasal congestion so you don't accidentally trigger that mouth breathing backup generator. And try to avoid alcohol right before bedtime to keep those throat muscles firm and toned rather than completely relaxed and collapsed. Beyond just the daily habits, we can totally optimize our environment and even seek targeted medical steps. Staying hydrated and using a humidifier if your room air is dry keeps those airway tissues from becoming sticky and easily agitated. And finally, if you're dealing with chronic structural blockages, like a deviated septum that is physically crooked, consulting an ear, nose, and throat specialist is really the best, most effective path forward. They can address the actual architecture of the airway in ways that lifestyle tweaks simply can't. As we wrap up today's explainer, I think this quote hits the nail right on the head. Snoring and sleeping with your mouth open are often your body's way of signaling that airflow isn't as smooth as it should be. We really need to reframe how we think about noisy sleep. It's not a personal failing, right? And it's not just a funny punchline for sitcoms. It's an important mechanical distress signal from your body, literally asking for a clearer path. Identifying the root cause can absolutely lead to quieter nights, deeper sleep, and significantly improved well-being overall. So later tonight, when you turn off the lights and your head hits that pillow, I want you to evaluate your own habits. Think about the mechanics at play. Are you breathing freely, or are there bottlenecks you've been maybe ignoring? What is your body trying to tell you tonight? Thanks so much for joining me for this explainer, and hey, here's to a much quieter, more restful night ahead.